Hey everyone, just wanted to go over a few items from week one for our class. So I wanted to speak a bit about health policy. I think there's a little bit of confusion in the class, and I just want to make sure that we're clear on what types of policies we're talking about. So when we're talking about health policy for purposes of this class and in general, health policy is typically a public policy. So not the type of policy, any of you work in an organization where they have policies and procedures. That's not the type of policy we're talking about. So we're not talking about, say, Allegheny Health Network developing a new policy with regard to, um, you know, how to how to register a patient or something like that. Even though it's related to healthcare, it's related to the organization and the operations of that organization. That's not what we are talking about when we talk about health policy. We're talking about health policy. We're talking specifically about legislation or regulation. We'll talk more about that in a second. And it pertains to a population or a subpopulation. I'll just use, for example, maybe the Allegheny County Health Department. Well, they have. We'll just see all of the things that they've come out with through COVID. But maybe they say, okay, we're requiring everyone to stay in their homes for the next 30 days. And you can't leave unless you're an essential employee. So if they did that, that would be the health department, regulating our activity. Well, not mine. I don't live in Allegheny County anymore, but I'm regulating the activity of those that live in Allegheny County, which would be a subpopulation of the greater population of the state of Pennsylvania or of the U.S., whatever. So that's policy. Now that's a very extreme example. But that's the type of health policy that we're talking about. So we'll have health policy that is directed at different areas, and we'll talk about them in a second. But the purpose is that we're trying to impact the health, improve the health of that population or subpopulation. There's also a subset of health policy that is typically referred to as healthcare policy. And healthcare policy is focused specifically on the operation of healthcare organizations or the healthcare industry. So financing, organization, and delivery of care. So this policy back here, very general. It can be a policy that says, we want everyone to exercise 3 times a week. Well, that's kind of general. It's not something that's enforceable. It's not going to impact our healthcare organizations. It's just a nice thing to have. Or like Healthy People 2020. Great things in there. They're able to make some traction on public health, but not the types of regulations that we deal with in the healthcare industry. Healthcare policy are those regulations we deal with in the healthcare industry. So how do we get paid when it's a government payer? How do we have to deliver care? How do we organize our practices and our hospitals and our long-term care facilities, et cetera? And generally, we're looking at these from a operational perspective. We're starting to see now where some of the healthcare policy that's coming out is really working towards providing that equitable and efficient access to healthcare. So think about the social determinants of health and how in some instances patients don't get the access to healthcare that they need. Healthcare policy can help to deal with that. Medicare might come out and say, okay, we're going to put in place a payment system for additional federally qualified health centers, which are health centers that are located in areas that have a need that don't have health care. Or we're going to pay for telemedicine. So then people have access to care that are unable to access it otherwise. So lots of different things. But there's health policy, kind of general. A subset of that is healthcare policy, which is important as well. So these are just 2 different types of health policies here. Regulatory health policies are really what we deal with most often on the operational side of healthcare industries. So they're looking to drive how a particular portion of the population operates, and that to provide access to whatever care, services, whatever it might be. And if the organization that's supposed to be doing that chooses not to, there are sanctions. So for example, I was just reading an article about a HIPAA violation. So the HIPAA violation was in regard to providing access to medical records. So the patient had requested medical records, and they had waited 9 months for those medical records, and they were taking them to a new provider. They'd waited 9 months for them and never received them. So then they turned the organization in to the Office of Civil Rights, who is the government organization that monitors HIPAA compliance. And this place was found guilty of not providing access to a patient's medical record. Well, we have a law in place, a regulatory health policy that says people get access to their record within 30 days outside of any extenuating circumstances. And it ended up taking them about a year to provide the record to the patient. So, because of the issue and because of the case, there were sanctions imposed. So that's a regulatory health policy. You do what you're supposed to do to make sure that you're meeting the needs of the population. If you don't do it, then you could be sanctioned, fines, be unable to participate in those types of programs, etc. There are also allocative health policies where it's about distributing benefits throughout society or redistributing money or power or whatever, so that there's more equality throughout society. So we're starting to see more of this now, where organizations are kind of shutting down some operations and moving them to other places. Unfortunately, a lot of times when that happens, that impacts that other area where the facility or organization was shut down. So that's when allocative health policies come into play, where maybe the state or maybe even the local health department will say, well, hey, there's no services here now. What can we do to redistribute something here? Maybe we can set up a federally qualified health center. Maybe we can, maybe it's a rural area and we can set up a rural health clinic. Like, there are government policies on the allocative side to better allocate resources across the population. Stakeholders, just want to talk about this too. So stakeholders in health policy can impact everything from the original formulation, the implementation, and then also modifications of those. One of the big stakeholders are interest groups. So, and we've talked about this in the law class as well. Lobbying by interest groups is a huge part of just the political process in this country, but also specifically with healthcare. So think about large lobbying groups like the American Hospital Association, the American Medical Association, American Nurses Association. Like, all of these groups are industry groups for these large groups of folks across the country. Think of all the physicians involved in the American Medical Association. It can really impact overall the health policy making process when they all speak out. So also other stakeholders outside of interest groups, consumers and patients. So the folks that are actually supposed to be receiving the benefits of these health policies, we need to have a say too. We have elected our government officials to these positions based on our interest in their policies and their agenda. And if let's say they're looking at a new maybe some type of a health policy that we disagree with their view on, we need to let them know. That's the whole point of having elected officials. They're to represent us there. And if they're not adequately representing us, we need to have a say in that with them. And that is the same with government agencies. So if a government agency comes out with a new regulation, and as we talked about this in the law class, we can have a say in that. That's called administrative law. They'll publish it in the Federal Register for everyone to see, and we can make comments to them. So we can make them as a consumer or a patient. We can make those comments as a healthcare provider. We can make those comments as a healthcare organization. So we all have a stake in what's going on with these policies overall. Payers and insurers are also a key part of the stakeholders in health policy. Public insurance pays for that's governmental insurance, so something like Medicare or Medicaid. Private insurance is what the bulk of Americans have, which is typically group health insurance through their employer, or the exchange plans are what what folks refer to as the Obamacare plans. So, so there's lots of different players, but they all are stakeholders in health policy overall. And then the regulators as well. That's their role, is to be regulators and to manage the health policy. Device and pharmaceutical manufacturers, educational research institutions, other businesses and corporations, all very important stakeholders in the health policy process. So, so this is why we study health policy. Obviously, you guys, as as HSA majors or minors, should understand how to influence policy. You should try to engage in influencing policy, and it's not just about our own personal impacts or the impacts of of your organization. It's about helping the government or the regulators do the right thing. So it's no different than something bad happens to somebody. Let's say somebody is involved in a fight. If someone's involved in a fight, there will often be other people that will come to help. Maybe they're coming to break it up. Maybe they're coming to fight on your behalf. But when that happens, there are other people that step in. It's not just one person's problem. If we have a problem like that, in a fight or something like that, it's also not one person's problem that they can't access healthcare or that they don't have the money to pay for their healthcare expenses. This is a fight that we all need to fight to try and create some equality and provide care across the continuum. So hopefully that makes sense. Didn't want to belabor it too much, and I probably did belabor it more than I should have, but I just think it's important and helpful to understand a little bit about what type of policy we're talking about and why we're talking about it. It's kind of, as I may have said on this video, and I've recorded a couple today, so I don't recall, but I'm recording this on election day, and it's kind of ironic that I'm recording this on election day. I think most of us see our civic duty in voting, but that's not where it ends. We need to make sure that we are voicing our opinions, whether it's a professional opinion as a healthcare administrator or as a healthcare practitioner, or if it's our own personal opinion on the topic because we see injustices in our society. We need to voice our opinion to our regulators and to our to our elected officials to let them know how we feel about health-related policies, and make sure, obviously we can't make them vote or change the rules, but we can make it clear that we're not going to take whatever it is that they've given to us, and it's not, it doesn't settle with us, and we need to do something. We need to do better. We need to do better for ourselves, for others, and for our organization. So, so that's all I've got. Hopefully that helps a bit, and I will look forward to seeing everyone in the classroom. Thanks.